So, laminitis was the focus of what I was going to talk about tonight, and then move on to talk about equine metabolic syndrome and PPID, or Cushing's disease. Right, okay, sorry about that. So laminitis kills, unfortunately, 1 in 10 horses over the age of 15, according to a study that was produced by the University of Liverpool relatively recently. So if you look at the table down the bottom, laminitis features as one of the top reasons for euthanasia of older horses, accounting for 11.7% of euthanasias. And if you look at the higher reasons for euthanasia, they're not even specific diseases. We've got lameness, we've got colic, we've got chronic illness and acute illness. Now that obviously is a mixed bag of all sorts of things. So laminitis is one of the biggest killers of older horses, and it unfortunately kills a lot of younger horses as well. Which is why it's such an important subject to so many of us. Most of the cases of laminitis that we see have a hormonal explanation. They're either caused by equine metabolic syndrome, which is essentially obesity, as we'll come on to explain, or it's pituitary pars intermedia dysfunction, which used to be called Cushing's disease. So this is the message that needs to get out, is that most cases of laminitis have an attributable cause and can, to a greater or lesser extent, be prevented. So we really shouldn't be seeing horses suffering with laminitis, let alone dying with laminitis. So what does laminitis mean? Itis simply means inflammation. If we go back to the classics, those that remember their classics lessons from school, when inflamed, the laminae become obviously painful and they swell and they start to separate. So if you look at the diagram towards the bottom there, I've drawn in the laminae with those red lines, and there's 2 layers of laminae, one adjacent to the hoof wall and one adjacent to the pedal bone, the bone within the foot, and they normally lock together like a piece of Velcro, and they're normally tightly bonded. They're extremely clever because they allow the hoof to grow, and the laminae move across one another whilst maintaining a firm attachment. But if they become swollen and they separate, then the normal way that they operate completely breaks down and they start to pull apart. And then you've got 300, 400, 500 kilos of horse, potentially more, pressing down through 4 feet, and the laminae are separating. Those kind of forces are normally borne by healthy laminae, but as soon as they become unhealthy, they start to break down. So you then have a tearing of the 2 layers of laminae. If we look down a microscope, we've actually got 2 layers of laminae. We've got primary laminae and we've got secondary laminae. So there's a huge surface area, which is where the strength comes from when things are working as they should do. So it is very, very similar to Velcro. So these are electron microscope images from a colleague in Australia, who also produced this brilliant video showing what happens in laminitis. So that's the 2 layers of laminae, and he's applying a little bit of force to some damaged laminae, and you can see they literally rip apart. So that is exactly what is happening in laminitis. The horse's hoof is literally tearing apart, which is why this is such a hideous disease. And this is what we ultimately see on X-rays. On the left, you've got a normal horse's foot with the hoof wall and the pedal bone being nicely parallel. On the right, you've got the situation that occurs in laminitis, and the arrow is showing a direction of movement of the pedal bone when it's no longer being fixed to the hoof wall, just pulls apart, which is obviously excruciatingly painful. I hope you're not squeamish. I hope you're not having your dinner. I should have warned you about this. This is a cut-through section of a horse that's been euthanized with laminitis. This was actually a case I saw when I was at Glasgow. And the 2 arrows show you the areas that cause so much pain. You've got, with the top arrow, you've got complete separation of the hoof wall and the pedal bone. You've just got an area of air and blood clot where the normal laminae have just ripped apart. And at the bottom, because the foot's not being supported, the pedal bone is literally pressing through the bottom of the foot with 500 kilos of horse pushing down on top of it. So it's excruciatingly painful. And the nearest thing we've got as an analogy is our fingernail. There are similarities. One big difference is the fact we haven't got 500 kilos resting on our fingernails. But everyone knows how painful it is when their fingernails get pulled out. And that is exactly what's happening in this process. So as vets, we really struggle with the way people often take laminitis for granted. It is the second biggest killer of horses in the UK, one of the biggest in older horses. And it is a crippling disease in a species that is a prey species that has designed not to express any sign of pain. So by the time we see these horses showing signs of lameness, they are suffering significantly. So it upsets all of us as vets when we hear things like he always gets a bit of laminitis in the spring, or he's just got a bit of the lammy, or he's always a bit footy through the summer. I'm sure some of you guys will have heard these things being said. And people just play down laminitis because they see it so frequently, but that doesn't make it any less of a cause of suffering. You hear people say he's not laminitic, he's just a bit footy. Well, there's nothing else really that causes a horse to be footy in all 4 feet other than laminitis. So people have habitually trivialised this excruciating disease over decades. So what triggers laminitis? What causes it? Well, there are a host of potential causes, but the vast majority will be associated with horses being out on grazing and eating too much grass. And if they ingest too much grass, they get increases in the concentration of insulin in their blood. And insulin ultimately circulates around to the feet, and at high concentrations causes the damage to the feet. Now, there is another possible way that we get laminitis, with an overloading of food quite suddenly. Normally that is large amounts of grains, horses breaking into the feed store or similar. And we will get a slightly different kind of laminitis when that happens, and we get a build-up of toxins from the large intestine rather than a stimulation of insulin through the small intestine. And we used to think that most cases of laminitis were caused in this way through horses producing toxins in the large intestine, but the science has really moved on in the last 10, 15 years, and we now appreciate that the vast majority of cases we see linked to their hormonal problems develop because of high levels of insulin. And we know that normal horses and horses with laminitis will behave quite differently in how they respond to grass. Their insulin levels will get much, much higher if they're those laminitis-prone animals. And this is a lot of this is evolutionary, and it's down to genetics. So we know that certain breeds of pony, so Shetlands, Welshies, will be far more predisposed to having much higher levels of insulin that renders them at much higher risk of laminitis. Which is why we see far more laminitis in the fat Shetland pony in the front of that picture than we do in the thoroughbred behind it, despite the fact they're eating the same diet. And we can use this to our advantage in testing for the risk of laminitis. You can see on the graph to the right that normal horses, their insulins will go up after feeding. That's to be expected. That's what insulin does. But in laminitic prone animals, their insulin really does shoot up in quite an extreme manner. So we can use that difference to differentiate those animals that are more likely to get laminitis. Why does insulin cause laminitis? The honest answer is we don't know. There are a number of theories. It reduces glucose uptake into cells. So if cells haven't got a food supply, they're not going to work properly. So that might stop the lamina cells working. Insulin doesn't just control sugar levels, it does a plethora of other things as well. It controls the state of blood vessels, and with changes in insulin dysregulation, we get constriction of the blood vessels and we get a reduction of blood supply and therefore oxygen and therefore sugar to the feet. So that can cause the lamina damage as well. If we get damage to the blood vessels themselves, we get blood clots, and that can cause issues. And the final possible mechanism is the inflammatory action that insulin also potentially has. And if we get large amounts of inflammation, well, we always end up getting large amounts of inflammation, and insulin can contribute to that process. And it's probably a little known fact that a horse's foot has a higher requirement for sugar and oxygen than does its brain, which potentially explains some of their slightly scatty behaviour. But the foot is an extremely active part of the body, and it does require a really good blood supply. So if that's not occurring, then there's a high risk of damage. Sorry, it sounds a bit like someone's having their tea in the background. I don't know if someone's just joined and they could possibly mute their microphone. Everyone I can see I've muted, but if you have just joined and you're tinkering away, it'd be great if you could just mute. Thank you. I'll just let a few more people in. So why do we get high insulin levels that potentially lead on to laminitis? Well, we can sum this up quite simply, as I did at the beginning of the talk, either as a result of equine metabolic syndrome, which is essentially obesity, with obesity being the main factor that drives it, or potentially the other possibility is pituitary pars intermedia dysfunction, or Cushing's disease, as we used to call it. So these two things, equine metabolic syndrome and PPID, account for the vast majority of laminitis cases that we see. And with equine metabolic syndrome, if your horse has it, it is at 10 times the risk of laminitis. If your horse has PPID, then it's potentially at 5 times the risk of laminitis. And something that's changed recently is we've had an appreciation that a lot of these PPID horses also have insulin dysregulation, which potentially is due to equine metabolic syndrome. So there is a large overlap between these two conditions. But put simply, just about all of our laminitis cases result from one or the other. And equine metabolic syndrome is largely caused by obesity, but lack of exercise is also a contributory factor. The signs worsen in spring and summer when horses have got more access to rich pasture, and certain breeds are more predisposed to equine metabolic syndrome. So these are all the risk factors that have been identified in a number of different studies for laminitis. And just to back that up, there's been a couple of studies that have looked at laminitis cases and demonstrated that overall 90% of laminitis cases have an underlying hormonal disorder, and it's probably nearer 100%. It's just in that remaining 10% we don't have the diagnostic tests, or they're not always performed to be able to identify the precise cause. But if we could deal with equine metabolic syndrome and PPID, we would barely see another laminitis case, which would be fantastic for all of us. So this is a really busy slide, which I'm not going to go into in detail, just to highlight what equine metabolic syndrome is. I know we've got some vet students and vets listening as well. So equine metabolic syndrome essentially describes the chain of events that occurs when horses' metabolism or ponies' metabolism changes because they become so obese. And fat is not just a storage organ. Many of us think it's just there to store the excess calories that we ingest, but it isn't just that. It has a lot of metabolic functions as well. So as we get more fat tissue, this fat tissue produces a lot more adipokines, which are signaling hormones from fat cells. They cause inflammation, and they also alter the effects of insulin. And by reducing the effects of insulin, the body has to produce more insulin. And as the insulin levels get higher and higher, that affects the feet and increases the risk of laminitis. So equine metabolic syndrome is very similar to metabolic syndrome in people, which is type 2 diabetes. And it has a lot of similarities, including high blood pressure and altered reproductive cycling. But in the horse, the damage occurs in the feet, whereas in us, the damage occurs typically in the coronary arteries. But it's a very similar thing. So what do we see in horses? We see, obviously, excess adiposity, so obesity. We see fat deposition through the crest, around the eyes, around the prepuce or the udder. And we see chronic changes in the feet consistent with chronic laminitis. So essentially, equine metabolic syndrome is an avoidable disease, because if these animals had less calories and became less fat, they wouldn't get equine metabolic syndrome. But it is most likely to occur in animals with a predisposition to the disease. So those animals that are genetically more likely to become obese, and that is obviously strongly breed related. But whilst there is a huge genetic element, it is ultimately a management disease that can be prevented. So in terms of managing EMS, if we could manage obesity, we could manage EMS. And obesity is clearly an issue in many different species, including ourselves. Very conservative estimate of obesity in people would be around 25%. In dogs, 20 to 40%. In cats, similarly around 20 to 40%. So I don't know what people think it's likely to be in horses. Normally I would get people to put their hands up, but I'm not brave enough to get you to unmute your microphones. So I'll let you guess amongst each other. But there's a couple of studies being done now, and there's more coming through all the time looking at the rates of obesity in horses. There was a study performed in Nottingham and a study performed out of Glasgow that did similar things, and they got horse owners to classify their animals, and then a group of researchers went around the same animals and classified their level of weight. So in the first study, where they had 160 horses, 54% were classified by the researchers as overweight, whereas only 21% of owners considered their animals overweight. Second biggest study, 319 horses, 45% of them were classified as being overweight, 29% of the horses' owners considered their animals overweight. So there's two obvious take-home messages from those studies. One is that around 50% of UK horses are overweight/obese, and the other is that owners are a poor judge of their horse's condition because they always give their horses the benefit of the doubt. Worrying that the rate of obesity in horses is at least as high, probably higher, than it is for other domestic species. And this study that was published in 2016, maybe 17, from the Royal Veterinary College down in London, suggested that over 70% of ponies are obese, which is alarming. So why are horses obese? Well, horses were designed to live on stuff like this. And we often allow them to live on stuff like this. So it's little wonder that they end up getting obese because the environment they live in is not the environment they evolved to live in. Similarly with donkeys, I know we see less donkeys, but they suffer terribly with obesity and laminitis because we keep them on nice rich grass and they're essentially designed to live in the desert. So in the normal run of things, horses would gain weight through the summer and they would develop a state of insulin resistance. And that's entirely intentional because that allows them to survive the winter better. As they become insulin resistant, they preserve calories, they retain weight, and that allows them to survive the winter better, assuming there's a period of hardship over the winter, which is obviously what would happen in the wild state. In the domestic situation, however, we obviously mollycoddle our horses through the winter. We put them in a stable, we put a rug on them, we continue to feed them in the same way. We give them more food because it's the winter and it's cold, and they continue to gain weight, or they certainly don't lose weight. Generalising here, they typically don't lose weight through the winter. So in a natural state, they would go back to where they were before and they would have normal insulin sensitivity by the spring. But in the way we manage them often, and by not allowing them to lose weight through the winter, they remain insulin resistant and they become more insulin resistant year on year. And that obviously further potentiates the risk of them gaining weight. So another factor is how our perspective of what we do with our horses and what they should look like has changed. And clearly, we domesticated horses to do a job for us, and until relatively recently, they had to work, and they had to work hard. And if they didn't work hard, they didn't really have a place, most of them. Whereas today, they're largely pets, or they might compete. But even then, they're very well looked after. So they have a very different life to what they used to, yet we still continue to manage them in a similar way to the way we've managed them over the last few hundred years, feeding them large quantities of grains and so on, as though they were still pulling carts around the streets of Glasgow. We used to work them harder than we do now. A hunter was a hunter, it jumped thorn hedges. Now a hunter is more typically a show hunter, and it's a very, very different animal. It carries considerably more weight. And as all of our animals have done less exercise and been fed more, they've all gained weight, and we've all come to think that a fat horse is essentially a normal looking horse. So it's all about perception, and you can look at this pony, and if it was in the show ring, and this pony was in the show ring, you can see a great example of its type, or you can possibly look at this pony and see something completely different. It's all about how we perceive body condition, and how we perceive body condition has changed considerably over time. So I'm going to play devil's advocate and say that distorted perception is causing a whole host of welfare problems, and we essentially now reward obesity in the show ring. And I pose the question of whether it's acceptable. We reward horses that essentially have got a disease, that disease being obesity and equine metabolic syndrome. But rather than do something about it, we tend to slap rosettes on these horses. And what are the consequences of obesity? Well, laminitis, that's why we're here tonight, but also arthritis is worsened with obesity, immunity is lowered, a process of inflammaging advances, so horses that are obese actually age quicker and are more prone to have an inflammatory state, which is damaging to them than if they were not obese. They're less fertile. Obesity can cause joint disease in young stock, or increases the risk of joint disease in young stock if their broodmares are obese. It increases the risk of hyperlipemia, which is a potentially fatal disease where they get fat in their blood. It potentially increases the risk of colic because they get fatty masses within their abdomen that wrap around the intestine. And it potentially, and this is a little controversial, but there are studies to suggest that obese horses are more predisposed to bad behaviour. And naturally, being very obese affects performance. A lot of horses are carrying 20% more weight than they need to carry. So you can't expect a horse that's carrying an extra 120 kilos to compete in the same way as it would if it was 120 kilos lighter. So that's what I want to say about obesity. The second thing, sorry, just to jump on, I know our second speaker is going to touch a lot more on how to manage obesity. I just wanted to just highlight a few key points. We could talk for hours on each of these points individually, but I just want to just very quickly highlight the important points for managing obesity. And clearly, it's primarily about feeding. And if horses are already obese, then we want to try and aim for 1% body weight loss per week. And we have to manage feed intake quite carefully to do that. And a 1% body weight loss per week is very achievable with the right dietary advice. So in addition to limiting their hard feed intake or possibly removing it altogether, we often need to limit their grazing. Most horses, certainly ponies, can ingest their typical daily intake within 3 to 6 hours quite comfortably. So if we're turning horses out for 12 hours of the day, potentially even more, they can very, very easily ingest 2 or 3 times what they require. And they're never going to lose weight in that situation. They're just going to gain weight. So we have, unfortunately, to manage their grazing in some way, either the quality of it or the quantity of it, invariably both. Exercise, not always possible to get them as much exercise as we want, and I think you will be surprised how much exercise you need to do to burn enough calories to counteract the amount of feed that we often give horses. And the same is true of ourselves. I can't remember the figures, but it's terrifying how far you've got to run to burn off a Mars bar, and the same is true in horses. We should rug them less in the winter. I know it's a lot colder where you are than where I am, but most horses do not need rugs. Certainly not native horses, native ponies do not need rugs until it potentially gets less than 5 degrees, even sub-zero. Clearly horses evolved absolutely fine in sub-zero temperatures, and if they're acclimatized, they can cope with low temperatures. And there's quite a few studies now to demonstrate that most horses would much prefer to be unrugged than rugged. Some really quite nice, eloquent studies looking at equine behavior showing that most horses would really rather not have a rug. Thank you very much. And medicines, finally, I will just touch on medicines for managing obesity before I move on to PPID. Medicines should not be required for the overwhelming majority of obese horses and laminitis-prone horses unless they've got PPID. But there are situations where we do consider the use of medicines if horses aren't improving after a month or so, if they can't exercise primarily because of laminitis, but possibly other orthopedic disease, or if we really need a quicker route to weight loss because they're at high risk of laminitis or they're suffering as a consequence of laminitis, then potentially we might use medicines to speed the process along. But we don't do that without careful consideration because really this is a management problem that should be solved by changing management. So just to touch on medicines, and I know our other speaker will deal with the dietary and management factors of obesity later. There are 2 medicines essentially. The first one is metformin. And metformin is a drug that's used quite commonly for treating diabetes in people, but it's not very well absorbed in horses. What it does do, though, is act at an intestinal level to reduce the amount of glucose that gets absorbed. And by reducing the amount of glucose, we can reduce the amount of insulin, and that reduces the risk of laminitis. Unfortunately, metformin only acts for a couple of hours and can only have a fairly limited effect. And it is no substitute and never will be a substitute for a proper diet. So if they're not being fed appropriately, metformin is not going to make a huge amount of difference. But what it can do is take a bit of the edge off laminitis risk. So we can use it around high-risk laminitis times just to take the edge off the risk. But I would play devil's advocate and say if the risk is there, we shouldn't be exposing the horse to that risk in the first place rather than just covering it up essentially with metformin. There isn't a licensed treatment for horses. If you are giving metformin, you either have to give a human tablet or you have to give a powder that is made under license for horses. So the second medicine that you might have heard about being used for obese laminitis-prone horses and ponies is levothyroxine. And levothyroxine is also used in people. I would be surprised if there isn't someone listening that is not on levothyroxine because it is used very widely in people. It's important to notice, though, that fat horses aren't hypothyroid. We're not correcting a problem with their thyroid gland by giving them thyroid hormone. We're just increasing their metabolic rate to help them burn some calories and remove fat. There's also quite a few studies now to show that levothyroxine helps with insulin responses and overall lowers the amount of insulin that is present circulating, and therefore reduces the risk of laminitis. We know that levothyroxine is safe for horses treated up to a year, and we know it has been proven to be safe at 10 times the normal dose. So it is a safe drug to use, albeit it has to be used carefully, and the horses have to be monitored carefully. Typically, we use it for a few months to aid weight loss, but increasingly vets, particularly in the UK, are using it for shorter periods of time. It is quite an expensive drug, and people don't always want to go for 3 to 6 months of treatment or can't afford to, but you can get significant benefit with shorter courses of treatment. It's important, though, if you're using levothyroxine, that you get regular vet checks. They're pretty basic checks just to assess body weight and condition, possibly do some blood tests. None of that needs to be too expensive. But because levothyroxine is quite a potent drug and it will cause some horses to lose weight very quickly, we do need to be careful in monitoring. And it is a really effective drug for promoting weight loss, but it's not an easy answer to get around management. In the long term, you're going to have to change management to keep the weight off. Just touch briefly on some supplements that people might have heard of being used for the management of obesity. Unfortunately, there isn't any evidence that any of these really make a difference, either in horses or in people. And the table I show you there are the NICE guidelines that they use in the NHS, and that there isn't really any evidence in people for any of these things helping to promote weight loss either. So don't be sucked in to spend lots of money on supplements for weight loss, because they just don't work. So I've made it sound easy. You just reduce the amount of food intake, and if that's not working, then potentially you consider some medicines, although hopefully you don't need the medicines. But the reality is, we know that it's not easy to get weight off your horses, your dogs, your cats, yourself. And childhood obesity is a massive problem, and there are similarities between childhood obesity and obesity in pets. And we often look at that research because the psychological codependence between ourselves and our animals or our children is quite similar. And we do struggle to deprive our pets or our children of food because it's a negative experience. They don't like it and we don't like it. So we have to be a bit clever about how we do it to overcome these behavioural issues. So we need to weigh our food and be very disciplined about what we're giving our horses. Otherwise, we're going to cheat. Should I give them a little bit more? Do you think I can? Surely that bit is okay. You naturally want to give them a bit more and you want to cheat. So you need to be really objective about it. It can also help to use smaller bowls and scoops to essentially convince yourself that you're giving your horse a little bit more than you might be. There's nothing worse than a tiny amount of food in a massive food bowl. It's controversial, but it has been suggested that we should make feeding less pleasurable, and then that would reduce the behavioural challenges of removing that pleasurable experience, both for the horse and for ourselves. And we should really be feeding horses higher fibre, lower fat, lower cereal diets anyway, because that's what they're evolved to be fed. So by depriving them of some of or too much of those really nice chewy feeds that they really enjoy, it's painful in the short term, but in the longer term it might be a better way of keeping the weight off them. And in managing childhood obesity, this is such a stressful experience that they even teach people breathing control for them to be able to cope with the challenges of not feeding their children as much as they want to eat. So we don't underestimate the difficulties of trying to diet your horses sometimes. And you do need a buddy. You need some help. You need people on the yard to get behind you and not criticise you, which unfortunately often happens. People are just don't understand what horses should look like and don't understand how little food most horses need. So you need to be mentally strong sometimes, and you often benefit from professional support. So it's often worth speaking to your vets or other professionals to help you along the road with promoting weight loss. It is not easy. And some human studies do demonstrate the benefit psychologically and also physiologically of medications. So they're there. We don't want to use them, but don't rule them out if you're struggling. So that was equine metabolic syndrome and obesity, and a massive whistle stop, because I could talk on that subject for about a week, let alone about 30 minutes. I was going to move on now to talk a little bit about the second main cause of hyperinsulinemia, which is PPID, or Cushing's disease. And PPID, Cushing's disease, it used to be known. It was named after John Harvey Cushing, who was a neuroscientist who discovered the disease. We've discovered more recently it shouldn't be called that because that's a human term, really. What horses get is a dysfunction of the pituitary pars intermedia. It's just a bit of a mouthful, so we call it PPID. All that means is that the pituitary gland within the bottom of the brain dysfunctions, produces higher peptide or hormone levels than it should. These hormones stimulate the production of insulin, and that insulin, as we've already discussed, increases the risk of laminitis. So PPID, unlike equine metabolic syndrome, is unavoidable. Based on our current understanding, it's a degenerative change that horses get as they get older. So if they're going to get PPID, they're going to get PPID. But the good news is we can generally manage it reasonably well. So the clinical signs of PPID tends to be older horses because it is a degenerative disease that progresses as they age. They tend to get more hairy. They tend to get laminitis, or some of them get laminitis. They can have abnormal sweating. That can be excessive. That can be a difficulty in sweating. They tend to urinate and drink more than they would otherwise. They tend to become more lethargic. They will sometimes get fat redistribution, which can cause some confusion with equine metabolic syndrome and obesity. And they tend to be more prone to infections. But they don't get all of these clinical signs. They can have any combination, and sometimes the signs are very, very mild. So sometimes we need to test for these conditions. And not only PPID, but also EMS can be tested for with a simple blood test. We wish we could check for every disease with a simple blood test, and rarely is that possible. But for these conditions, it is. It's pretty cheap and it's pretty easy. In an ideal world, we would do stimulation tests, so we would give the horse something, and then we would assess its hormone response. We don't always need to do that. Sometimes we will do that off a single blood. In terms of treatment of Cushing's disease or PPID, there is only one licensed treatment, and that's pergolide. The trade name is Prosend. And it compensates for the nerve damage that causes the dysfunction of the pituitary gland. So the nerves that supply the pituitary normally produce dopamine. When they stop working, we have to give dopamine in the form of pergolide. And in the majority of horses, we get a pretty good response to treatment. There is an alternative that you might have heard of, which is a chaseberry extract. This is used in a misguided manner for treating PPID. This drug actually has been shown to act on prolactin production in the pituitary gland, but this is a different part of the pituitary gland. And it hasn't been shown to have any effect on the pars intermedia, which is the part of the pituitary that dysfunctions when we get Cushing's disease or PPID. And even the manufacturers of chaseberry extract will admit in their marketing material, I won't dwell on this, but they will admit that this drug doesn't do anything to change insulin levels or hormone levels. So I think what we really see is a possible improvement in clinical signs unrelated to the real disease process that's going on with PPID, but we don't see any reduction in the amount of laminitis risk. So it's a shame really when people rely on this drug because it's not doing it. It's not a drug. It's a herbal extract. It's a shame they rely on it because it doesn't actually reduce the risk of laminitis, and it does actually cost quite a lot of money, usually similar to the pergolide drug, which we know actually works. So just to make the point, treatment is expensive for PPID, and I'm not here to sell treatment of anything, and I'm totally independent of the practice, obviously. But I just want to highlight potentially that sometimes spending a small amount of money can be money well spent, both in terms of improving welfare, but also in terms of saving you money. We know that horses with PPID are 5 times as likely to get laminitis, and we know that roughly speaking, most horses, pergolide will cost £1 to £2 a day. Sometimes it's more if they need a high dose. But if you work out, and this is extremely conservative, what a bout of laminitis can often cost, and I appreciate not everything gets done for every bout of laminitis, but you can very easily see that the cost of managing laminitis in purely financial terms very quickly outstrips the cost of prevention with pergolide. And that obviously doesn't include the pain and the stress associated with laminitis, the fact that damage is cumulative and ultimately will be fatal. And it doesn't include the amount of time you have to take your horse out of work for laminitis, and obviously it costs money to keep a horse. So if you can't exercise it, that's a waste of money in itself. So in terms of optimal management for those people that have horses with PPID, we need to tweak the dose quite a bit. Well, not always, but in some cases. So monitoring is really important, and often we try and check them a couple of times a year. I think it's fair to say we overtreat a lot of horses with pergolide, which is another advantage of monitoring. If we monitor them well, then we can reduce the amount of treatment they're getting, which ultimately will save you a considerable amount of money. Sometimes there are challenges in diagnosing PPID and differentiating PPID from EMS, equine metabolic syndrome. So regular testing helps us to weed out the horses that really need pergolide from those that just need management of equine metabolic syndrome. And like I've already made these points, really, that there are costs associated with treatment, but the cost of doing this properly actually is far, far less than getting it wrong and over-treating and not necessarily stopping those bouts of laminitis. Other things we need to consider in addition to medical treatments, and these are every bit as important, probably more important, we need to consider weight control and dietary management in PPID as well as in equine metabolic syndrome. We need to check insulin levels because it's still the insulin that is leading to the laminitis. We need to monitor carefully for dental disease, gingivitis, periodontal disease. These horses are getting older and they're at more risk of dental disease because of the Cushing's disease. We need to keep them up to date with vaccination because they're at more risk of infection. We need to keep them up to date with worming, or certainly monitor their worming counts carefully because, again, they're at higher risk of getting parasitic infection. That risk is pretty negligible, but it's still good practice to be up together with their worming, or testing for worming anyway. We need to clip them if their hair coat is still growing because otherwise they can get far too hot and sweaty. And we need to make sure their feet are managed properly by seeing the farrier regularly because if there's suboptimal control of their PPID, then their horn quality may not be as good and they may have had bouts of laminitis in the past. So regular farrier is important. Most PPID cases will respond pretty well to treatment. There are still, however, quite a lot that don't respond completely. So we get a degree of improvement, but we don't always get complete improvement. And sometimes that doesn't matter. But if we're still seeing clinical signs, then potentially we need to understand why treatment's not working as well as it might. And that might be due to the disease itself, or that might be due to issues with medication, or issues with compliance, with getting the medication into the horse. And pergolide is quite short-acting, and it's not absorbed that consistently between horses, which is another reason for regular monitoring. In terms of compliance, I'm sure those of you that have used pergolide will realise that sometimes you have to split the tablets, and that's not always that accurate. And a lot of horses don't like eating the tablets. They will spit them out, and if we mix them in water or expose them to light, the tablets don't work as well. So we shouldn't be crushing tablets because that potentially deactivates them and puts you potentially at risk from an aerosol of dopamine. And we shouldn't really be storing broken tablets for a long period of time. So giving the tablets can cause problems, and some horses don't take them that brilliantly. So in an ideal world, we would try and dose more frequently, which is another reason why people will split the tablets. We would ideally give the drug twice daily often because that spreads the dopamine out. That's particularly if they're showing signs of not wanting to take the tablets or going a little bit off food because of the pergolide, which doesn't happen often, but it happens occasionally. And if the licensed pergolide preparation isn't working brilliantly, then we can consider alternative medications, but we don't do that very often. The other option, if you're struggling, and it's a minority, but if you are struggling, it's worth speaking to your vets potentially about alternative pergolide preparations, because there are unlicensed, and so we shouldn't use them willy-nilly, but there are unlicensed preparations that are easier to get into horses, which you can consider if you're having problems. So that's pretty much me. I just wanted to make the point that we've talked about equine metabolic syndrome and we've talked about PPID or Cushing's disease because these two conditions together account for 90% of laminitis cases. And the reason they do that is because they cause high levels of insulin. So if we could control obesity, we could get our horses exercising more, particularly manage them better through the spring and the summer, and particularly manage them better if they're of those breeds that are predisposed to getting fat, then we really could massively reduce the risk of laminitis. And if we can treat PPID effectively, we can stop laminitis developing in the majority of those cases. So if you have got laminitic cases or you know of laminitic cases, please don't bury your head in the sand about it. There are things that can be done to stop laminitis recurring. Manage obesity, exercise them more, and treat their PPID if they've got PPID. So what specifically should you guys do? Feed and manage your horses appropriately. We'll come on to that later this evening, especially if you realise you've been in denial about the body condition of your horse or pony. Get dietary advice from someone reputable. There's loads of good advice out there. There's also lots of advice out there from people that want to sell you horse food. So just be careful. Most of these horses don't need nearly as much food as we are giving them, and the last thing you need is to be encouraged to feed them more. Dietary advice should be extremely simple. So go to someone reputable, preferably someone independent. Avoid spending too much too much money or any money at all on hard feed and supplements. Balances are really useful and important, but beyond that, you don't need much in the way of hard feed and supplements for most of these horses. You can spend your money better elsewhere. If you have got a horse or a pony with a history of laminitis, then think about getting it blood tested for equine metabolic syndrome or PPID. Your vets might advise you don't need a blood test. They might be able to make the decision, but just at least seek advice. Don't just leave a horse with a recurrent history of laminitis without further investigating what might be going on. That is a serious welfare concern and arguably is neglectful. And get your horses if you've got them, horses with laminitis, PPID, equine metabolic syndrome, get them checked regularly, because that will be better for them and it'll be better for you, because you can save an awful lot of money by being more careful about how you treat and how you manage these horses and getting it right. And please just spread awareness. The people that are listening tonight are probably the people that are already often doing the right things and trying to do what they can to prevent laminitis and manage it and deal with obesity. Unfortunately, it's the people that don't come to these talks that we really need to speak to about the risks of laminitis to try and prevent it from happening in the future. So please try and help us to spread the word that laminitis is preventable and people really should be doing a little bit more to deal with it. If you want a bit more advice, if you want advice specifically on obesity, this is a brilliant leaflet that was produced by the University of Liverpool and the Horse Trust. You can find it online. If you've got any issues finding it, then I know the guys at Central will find it for you. Another place to look at is the BEVA, British Equine Veterinary Association website, where there is a resource there with loads of information for horse owners on managing obesity, because this is such a massive problem to us. And again, I'm sure the guys at Central will share those links with you. But there's loads of information out there. If you're struggling or you want more advice, then please speak to the guys at Central, or you're very welcome to contact me. Thank you very much.